Hello, it's Dr. Rhonda Johnson, and today is Sunday, November 1st, 2020. Our country is literally on fire with this coronavirus pandemic. Yesterday, the coronavirus infected 100,000 new people. Folks, you know there are 86,400 seconds to every day. This means that yesterday, this virus made a home in some person's body in the United States every second of yesterday, and then some. So what I thought I would do today is give an update on what the medical community has learned about COVID-19 infection since the early days of this pandemic. So here we go. Experts believe there are 3 distinct phases of COVID-19 infection in people who test positive for this disease. Now again, not everyone has the same expression of COVID-19, but each of these 3 phases is characterized by how our bodies interact with this virus. So phase 1 is called the early phase. And some doctors call this stage 1. So I'll go back and forth between phase 1 and stage 1 interchangeably. But in phase 1, this is the early infection. The virus is multiplying inside our body. Now, many people don't have symptoms. And if you have symptoms, it's likely to be mild symptoms that can be confused with a common cold or the flu. Then people go into the second phase, which is the pulmonary phase, or stage 2, phase 2, when the immune system becomes strongly affected by this viral infection. And people get primarily respiratory symptoms such as cough, shortness of breath, and low oxygen levels are possible. In this phase 2, which is primarily the pulmonary phase, problems with blood clotting can pop up as well. And then there's the third phase, which is the critical phase. This part is characterized by a hyperinflammatory response, when the immune system gets hyperactivated and can cause injury to the heart, kidneys, and other organs. This phase is typically associated with either a cytokine storm or a bradykine storm, these high inflammatory molecules, where the body may attack its own tissues. Now again, there can be overlap in people among these 3 stages of the disease. So those are the 3 phases or stages. Now I want to talk a little bit about Basic 101. Most people with COVID are infectious 1 to 2 days before they have any symptoms. Now remember that this virus usually comes in our body through either these aerosols or these respiratory droplets. We can't see them. The droplets are typically produced when somebody coughs or sneezes, and the aerosol is just coming out through normal talking, breathing, in people, who are releasing this virus, who are contagious. Now, the time from when you inhale this virus in your nose and the symptoms start is usually 5 days. But some people, it can be longer. It can be incubation as long as 11 to 14 days. But the first symptoms are generally like a cold for most people. But by the end of week 1, and usually by the end of week 2, at least for adults, pneumonia occurs. And this COVID pneumonia produces pus, which is fluid and dead cells. So most people develop the signs of an inflammatory and infection in the lungs. And that's fever, cough, trouble breathing. And if this response gets worse, a person may need to be hospitalized for respiratory support. Here in the United States, most people, if they're going to get admitted to the hospital, they get admitted to the hospital about 1 week after their symptoms begin. Now, phase 3 is that hyperinflammatory response. That's the rapid deterioration phase. Now, recovery from COVID. If you're going to recover, the usual time it takes is around 22 days. And for people who die from COVID, death usually comes around the 18th day. But again, this is just generalities. Individual patients may respond different. So yes, it's true that doctors have learned a lot about treating COVID-19, and they have some drugs such as remdesivir and steroids, dexamethasone, for treating the different phases of this infection. And although research by the scientists is progressing rapidly, there are still no drugs that are proven to treat COVID-19. Right now, it's supportive care. Now, the challenge is that many people with COVID-19 are undertreated. Many people don't have a relationship with their doctors or primary care doctor, and a lot of times they don't come into care until it's too late. So this is the update on the COVID-19 that I wanted to share. Again, the best COVID-19 infection is the one that never happens. Folks, try your best to prevent coming infected with COVID-19. And I want to just say that I have recorded these videos and put them on my YouTube channel, and they're in a library there. So if there's any information that you may want to refer back to, please know you can check out my YouTube channel and the information will be there. Stay safe, folks, and have a blessed day.